welcome to the tour of the Clinical Skills Lab. I'm Dr. Bausmith. I'm one of the clinical instructors here and a veterinarian in the small veterinary clinic. And I have my student ambassador here.
Hi, I'm Jose. I'm a third semester student here at Ross.
So I'm just going to show you around some of the common models that we'll have in our labs. We have set up several ones for safety handling and restraint of small animals. We have injections, phlebotomy, and vascular access as well. So we've got some canine models spread around, kind of all around. So these are used for various different things, again, such as safety handling and restraint. So we want to make sure that our students are applying muzzles and handling our canine patients appropriately, so placing them on the table. And we've also got many different injection models. So we've got sub-Q and intramuscular models here. These are really nice to practice our skills, especially drawing up whether it's vaccines or different drugs. And so practicing giving those sub-Q and intramuscularly as well. We always have literature available for our students, so if they're ever confused or you're not sure where to go from, you have an instructor with you, but you also have plenty of different paperwork here to help guide you. We also have our fun-looking little Labrador models here. So they've been used, but they're very good at what they do. So these guys are for phlebotomy and IV injections. So these are used for our jugular phlebotomy here, as well as our cephalic. And we usually do have a saphenous model back here as well. So it's really nice if you come into vet school with experience, that's great. But we also understand that not everyone comes with a ton of hands-on small animal experience. So that's why we have these labs to try and help you get experience and just feel comfortable with the tasks before you start being tested on them and doing them in real life. So Jose is going to keep working on his little patient here and getting some blood.
Just going to draw some blood. These guys are pretty reliable.
Yep. We also do have some different models here. These are just for some sub-Q injections, again, just to get used to that process of tenting skin and inserting needles and giving injections underneath the skin over here. You see Jose is a pro over here doing some phlebotomy on our saphenous or our cephalic veins. So that's awesome.
This one's actually kind of wonky. This one's actually kind of wonky. Maybe we can...
It's fun when you're under pressure, right?
Yeah, right?
We expect that you guys might be a little nervous when we're watching you, so that's why we have plenty of opportunities for everyone to practice their skills. So we've got our sub-Q injections. We also have more safety handling restraint. We like to practice fear-free here, so we'll put our kitty friends in little kitty burritos. So we wrap them up nicely. We'll practice putting on our kitty muzzles. Jose, if you want to put on our kitty muzzle appropriately to our little furry friend here.
Seam under.
Yes, the seam is on the bottom. So again, really nice opportunity for those that maybe don't have too much experience handling feline patients.
And it's good to practice this stuff on these models because I personally had never used one of these before, so yeah, better to learn on this guy.
It is quite nice. We always have a cart available. It has all of our supplies here, so we always have flush that's drawn up if you're placing IV catheters. We've got everything, all different types of catheters, needles, syringes, pretty much everything that you would need in a typical supplies cart. We try and keep them well stocked for you guys when you guys are practicing, but it really does have everything that you need. So as we move down, we move sort of to our more large animal stations. So we don't want to do just small animal, we'll do large and small. So we've got, again, more literature for those that aren't very familiar with large animal injections or phlebotomy or safety handling or restraint. So all of this. We've got our lovely little goat model here. We love this guy. So he is used for our jugular catheters. So these are something that maybe I find that actually not a lot of people are very comfortable doing with when they come into vet school. So this always throws people for a loop, right, Jose?
Yeah, a little bit. Throws
everyone for a loop.
Not too bad.
But it is quite nice to practice this. You will do it later on in semesters when you get into your 7th semester and you're doing live animal surgeries and you're in anesthesia. You are going to be placing catheters in the jugular models of your donkeys and your sheep. So it's nice to have that quick hands-on experience, as well as just doing basic phlebotomy and injections into there. Okay. And then we also have, these are more small animal based. These are supposed to be our cephalic limbs. So if we picture our patient's arm kind of being held out like this, and someone would be holding off up here. So you can do phlebotomy, you can do injections, and this is most commonly where we'll have our students place catheters into our patients. So again, if you come here with knowledge of how to place catheters, that's wonderful, but if you've never placed one before, it's no big deal, right? You have plenty of chances to practice that here. Again, we love to help you guys go through these things. There's plenty of us that walk around the rooms while you're in these labs to make sure you guys are doing them correctly. And you also have the support of your other colleagues and TAs and everything else to make sure you're doing well. So that is that. Jose's still working on his catheter for large animal. Lovely. It's doing great. It's always a bit intimidating the first time you try them, but with practice, you can definitely get good at them. Just make sure that your blood's on for you.
Okay.
And as he's working on that, we do also have some other large animal pieces over here. So we've got our cow tail veins. I know it doesn't look like a cow, but if you use your imagination, this is kind of the back half of a cow here, and this is its tail with its tail vein lying around that bottom aspect, right? So we can practice the students lifting these up and gathering blood using vacutainer tubes, which is a new skill. So vacutainer tubes into the tail vein there, as well as using the kind of triangle side neck profile of our large animals. Right here it's a cow, but it could be a horse, it could be a donkey, it could be whatever large animal you choose, and just practicing doing our intramuscular injections, which is a slightly different technique than with small animals. But you could do intramuscular injections here or sub-Q injections if you feel. So a lot of really good models here. We use them in all different semesters, whether it's first semester, second semester. We typically do reviews of them in fourth semester as well, and the skills follow through your entire career at Ross. So that's all the models that we have set up, at least. There's plenty more that you'll experience in the different labs here, but I'm going to hand over to Jose, see if he has any experience that he wants to share here.
Yeah, absolutely. I will say that a lot of the material I've learned through these labs is a lot of techniques that I wasn't taught in my years of working as a technician. So it's been great to see us held to a standard, even to the most meticulous level, which is a great learning experience, especially on consistent models like these. It stays well stocked, so we can come at all hours to practice downstairs as well. And we hold ourselves accountable, and there's TAs that show up as well. So it's a really, really great standard to learn by here.